Brian Rudkin. Molecular and cellular neurobiology and related cancers is what I did my research in for a number of years. And currently, I'm a young research director emeritus in the CNRS at the University of Lyon Stem Cell and Brain Research Institute of INSERM. I'd like to thank the organizers of this event, and you'll understand why, giving us the opportunity to present not only in Poland, but also to Europe and beyond. And that's something that we are doing all the time. We're listening and mobilizing civil society, as the title says. Now, where do I point? There we go. Let's start out with saying you cannot have healthy life, plant, animal, or human, on a sick planet. Now, that's not me saying it. It's Margaret Chan who started that back with the COP15, I think it was, in Paris. And other people have done derivative of it. This is my adaptation. I have said, however, if you know what the microbiota is, that humans are the planet's microbiota. And you have humans that are doing good things, and you have humans that are doing not so good things. And the objective of the foundation is to try and get more humans doing good in the context of One Health. In order to do that, we need to get people to row together in the right direction. And that is not necessarily an easy thing to do. It requires excellent communication, social and political engagement. And these are some of the things that we are doing. We're here to speak about the EU Global Health Strategy and how our actions integrate with that. Now, I can't read this, I'm sure you can't either, but these are guiding principles of the EU Global Health Strategy. And I will say now, and please do take my word for it, that the action of our foundation and the activities of our foundation address essentially all of these in one way or another. Number one, we heard it already, One Health. Now, the organizers said, please be careful, Brian, because we're having enough difficulty getting politicians and people to understand what global health is. Please don't introduce the concept of One Health if you can avoid it. I'm going against that point of view, of course, because it's written in the European Global Health Strategy. And you have to address the One Health issues, which is healthy people, animals, and environment. One Health inspires the merging of silos globally. The FAO, the UN Environment Programs, the World Health Organization, and the WOA, World Organization of Animal Health, have gotten together to create the quadripartite, of which we've heard two of the members of the One Health high-level expert panel present today. So it's very important. You want to merge silos, don't break them. People need to have expertise, but they need to know how to also communicate among themselves in order to make things happen. The EU is also structuring the One Health governance. A recent report that came out at the end of last year on One Health governance in the European Union speaks to this essential fact. So who are we? The One Sustainable Health for All Foundation was created in 2020 by Benoit Miribel and essentially with the objective of increasing dialogue and innovative projects between public and private partners in the promotion of one sustainable health for all. Initially, we were under the auspices of the Rudkin Foundation, a local foundation in Lyon, and recently on July 4th, actually, 2024, we became under the aegis of the Institut Pasteur. And you can imagine that has given us a significant boost in terms of our, let's say, projection to international affairs. There are two main activities. One is the One Sustainable Health Forum that was created in 2021, and I will speak to both of these, and the One Europe for Global Health coalition that is run in collaboration with the Warsaw Foundation in Berlin. We have partner organizations in 15 member states and 3 associated. You'll notice Poland isn't there. We hope that after this meeting, we will have entities from Poland participating in this. Whoa, do I just have to point, or are you doing this? The magic. Great. And we have 15 member state, I'm sorry, in addition to those 18 entities, we have 14 additional countries from around the world. That was as of September of 2024. I haven't yet gotten the update. We're a member of the quadripartite One Health Partner Platform and Community of Practice. We are in the steering committee of PRISOD, which is the Preventing Zoonotic Disease Emergence initiative stimulated by France. And the idea is to also participate in their working group to engage stakeholders and co-design One Health networks and policies. There are two main projects, the One Sustainable Health Forum and the One Europe for Global Health Coalition. The One Sustainable Health Forum, in its original format, was comprised of 6 international working groups addressing issues of very significant importance. What is the impact, our impact on the planet, planetary health? Pollution, of course. Also sustainable agriculture. You have to feed the people and the animals that are on the earth. Also global health, the interaction between humans and environment, healthcare access, governance, as well as finance and local practices. Obviously, it's not somebody in New York who's going to tell somebody in Thailand how to take care of their local issues. However, somebody in Thailand can come up with a resourceful and intelligent idea that could help people in the global north. So we've had over 80 experts from over 25 different countries, of which 40% were from the global south, working on these questions. This has given recommendations from the international working groups that were essentially consolidated. You're looking at the consolidator. With coming up with 4 different pillars. One was public knowledge, one was finance, data and scientific evidence, which is extremely important, and strategy and governance. This document of over 100 pages includes also the declaration of One Europe for Global Health. In addition to that, it has been translated, initially it was in English, but it was translated into French and Spanish, and it's in the process of being translated into Chinese. And we hope, therefore, we've covered almost all of the languages that most of the population of the world speak. Now we have 10 international working groups, and I have been asked by Benoit Miribel, who is the founder of this foundation, to try to make this work in an efficient manner. So we have added a few more topics to the working groups, including the One Health in humanitarian settings, the One Health next generation, education and communication, and One Digital Health. Because we believe, as we've heard here, that data, curated data, traceable data, secure data can be used intelligently through artificial or human intelligence. These groups are organized, the co-chairs of these groups participate in what we call a convergence group under the guidance of Juan Lubroth, who is also the coordinator of our scientific council, and Anne-Françoise Berton, who is from the ANSES, the French Agency for Environmental Security as well as Nutrition. And they are going to be working in terms of strategy and scientific direction of the convergence group to ensure that we are delivering on our objectives. Now, what are the objectives? Well, when the foundation was created by Benoit back in 2020, the idea was to try to address and accelerate the Sustainable Development Goals of the United Nations. And these are the goals, you know them all, I'm sure. And so we asked the question recently, of these 10 international working groups, do we really address any of them? And guess what? We were very happily surprised to see that the topics that were covered by the international working groups actually covered all of the Sustainable Development Goals. Now, that was very encouraging. And so it meant that we were indeed trying to accelerate all of this. So the One Sustainable Health Declaration is in the OSH Forum. Its objective is to understand, advise, and operationalize. The One Europe for Global Health Coalition, along with the Warsaw Foundation, has the objective to compile and communicate to policymakers, enterprise, finance, civil society. We say that if we can even do it to children in nursery school, get messages to them, we might be able to influence the politicians. Next slide. Some of the concrete recommendations and implemented examples, in addition to the One Sustainable Health Declaration, are the financing of One Sustainable Health, how countries can get the most out of blended finance. This was in a group that Agnès Souka, who just presented, is participating in as co-chair. Which essentially shows now it's really interesting because they started this study before the effort of the United States administration to deconstruct global, call it operations. In design, actually, I have to say something. In design, you do something called deconstruction when you want to rebuild something in a better way. So let us take this as an opportunity, and that's essentially what's happening here. People are now becoming resourceful, trying to figure out how can we do better with less. The other aspect was the policy brief from IWG9, Humanitarian Action in the Planetary Crisis, that is also accessible and speaking to the importance of One Health in these humanitarian settings. Now, of course, the idea is to share the love, among other things. And the way we're doing it is through the One Europe for Global Health Coalition. It started in part because of Jérôme here. The French government invited Benoit to consider coming up with recommendations on how to reinforce a European health union. And we came up with recommendations from the international working groups that I, again, consolidated into what we called at the time the Lyon Declaration, but it became the OEGH, the One Europe for Global Health Declaration. And what you see on that left side of the slide is actually 27 ministers of health from the member states of Europe in Grenoble listening to Ole Peter Ottersen, who was one of our champions, and Benoit Miribel presenting the recommendations. We then decided to use the rotating presidency of the Council of the European Union to take the message to the different countries, but also to listen to what the different countries are interested in. What are their priorities? So we went to the Czech Republic, we went to Sweden. That is the Nobel Forum where the Nobel Prize is attributed. We went to IS Global in Barcelona, a fantastic institute in global health at the initiative of EGRIN, the European Global Health Research Innovation Network, Institute Network, as well as in the KU Leuven, where we had Peter Piot, who is the personal advisor to Ursula von der Leyen, present along with Stefan Constantinescu, who is the president of SAPEA, the Scientific Advice Mechanism member. And finally, we went to Hunren in Hungary during the presidency. Now, unfortunately, due to reasons beyond my control, we couldn't get the label of the Polish presidency, but we are very grateful to the joint action to allow us to present here. We have several people from our foundation. Agnès Souka, who is a staunch supporter of us. Tomorrow we'll have Ole Peter Ottersen, and today myself. And this is just to show that we've gone from France, Czech Republic, all of these down. Now we're in Poland. We're going to be doing Denmark, and the focus of Denmark will be data, which is a very important thing because Novo Nordisk just bought a supercomputer for the Danish government to be able to do the bringing together of the data and analyzing it using AI. What did all this generate? It generated the opportunity, an opportunity where we decided that it was possible to create a world network of One Sustainable Health Institutes. Now you'll say, what's that? Next slide, if I have to say next slide. Well, it's essentially, the idea is to create local and regional One Sustainable Health institutes that would offer advice and guidance to civil society and government to leverage the commitment and support of existing, and I underline that word, existing public and private actors. No need to reinvent the wheel. And to leverage member state initiatives to sensitize society to One Sustainable Health benefits and how to. And the idea is to do this together. Now, this was discussed at the World Health Summit in 2023, and then again in 2024, where we had representatives of the different countries present in a workshop in collaboration with the World Health Summit. We had Africa, China, Asia, Latin America, and the Caribbean, North America, Europe, and beyond, and the WHO Academy. These are the entity that has just been inaugurated in Lyon in December to encourage training and education at all levels, from the, as what Jérôme was saying, from the people in government to people in the field. And extremely beneficial for us, because one of the three pillars of the WHO Academy in terms of training is One Health. And you can see the entities that are participating with this: the Fondation Galien Africa, supported by the Gates Foundation, the Research Center for Eco-Environmental Science of the Chinese Academy of Science. For the Asia, we have Field Crews, a staunch supporter of our efforts, and it's extremely interesting to be working with them because they are also a member of the Pasteur Network, an international network of over 30 institutes around the world, and you can imagine how that can leverage what we are trying to do. And of course, ourselves. And it just so happens that since then, we now have 6 world regions, with the Middle East in the St. Joseph's University, Beirut, as well as in India, we are currently discussing with the India Institute of Science. But the key point is it's realistic, it's feasible. Why? Because they're doing it already. And all we're saying is we're bringing you into a network where you can communicate, you can exchange good practices, and work towards a common goal. And it encompasses training and education, innovation and research, intelligence and surveillance, of course, for accountability and metrics, as well as governance. And Ole Peter will be speaking about governance tomorrow. The idea, of course, is to get everyone to row in the same direction. And that is what we are hoping that we will do. Now, if I have at least 2 minutes more, I will just finish with a little plug. At the Geneva Health Forum and the World Health Assembly of WHO a couple of weeks ago, in his opening address, the President of France, Emmanuel Macron, announced the One Health World Summit would be taking place in Lyon. I'm from Lyon. Actually, my adopted city is Lyon. I'm actually from Philadelphia. On November 3rd, One Health Day. And we are happening to have our annual event, One Sustainable Health for All, Lyon 2025, from the 2nd to the 25th, from the 2nd to the 5th of November in Lyon. And therefore, we have created essentially the space to welcome the government, if I may say. Whoops, go back one. Go back. There we are. We will have the presentation of the concrete recommendations of the 10 international working groups in the morning, the presidential summit on One Health in the afternoon, the new initiative that we are doing, it's the One Sustainable Health Factory, where people and entities that have actual concrete evidence of and solutions for implementing One Sustainable Health will be able to present. And I think, yes, just as our member organizations, we have over about 150 different member organizations from around the world participating and assisting in what we are doing. And I think that should be the last slide. Thank you so much.